Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
More than 500,000 children in the UK were not given a crucial measles vaccine between 2010 and 2017. That's according to new figures from the charity UNICEF. It comes as NHS Chief Simon Stevens warned measles cases had almost quadrupled in 1 year and said people rejecting vaccines was a growing public health time bomb. Our health editor Hugh Pym reports.
Measles is a highly infectious viral illness. Cold-like symptoms are followed by a rash like this. Health chiefs around the world are increasingly concerned about the steep rise in the number of cases. So why do they say children must be vaccinated? Put bluntly, it can be fatal. 110,000 people globally died from the disease in 2017. If enough people are vaccinated, that ensures the whole population is safe. But if too many don't have the jabs, there's a risk of measles spreading to children like Alba. She was just too young to be vaccinated. She developed measles and was in hospital for 9 days.
Are you jumping? Bounce, bounce, bounce.
She recovered and was back home last week, but her mum told me it was a frightening experience.
There was a day where we both thought we were going to lose her. So it was heartbreaking and terrifying at the same time. But you want to stay strong because you want to fight for her as well. And it's been the worst few weeks of my life. It's been horrible.
What's happening here across the UK? Between 2010 and 2017, according to the charity UNICEF, more than 500,000 children weren't vaccinated. Last year, there were 953 cases of measles in the UK, more than 3 times the number the previous year. So why are some parents refusing to vaccinate? Experts blame social media for spreading false claims about injections harming children. At this toddler group today, parents I spoke to said they ignored negative messages about vaccination.
I can understand why people believe what they read, but I think, follow the NHS line.
I think it's always important to challenge what's available, but for me it's listening to the healthcare professionals.
I'm just thinking, how to protect him as soon as possible. So.
As for Jilly, she just wants other parents to know what can happen if their children aren't vaccinated and get measles, and perhaps spread it to others who are too young to be protected. Hugh Pym, BBC News.
Now, it's been described by the NHS chief as a public health time bomb. The number of cases of measles in England has almost quadrupled in the past year, leading the head of the health service to issue a warning about the growing number of parents refusing to vaccinate their children. An analysis by the charity UNICEF found that among high-income countries, the UK had the 3rd largest number of children who had missed their first dose of the measles vaccine. The Health Secretary said today he was particularly worried anti-vaccine fake news was being spread online. Minnie Stevenson reports.
You do not have to panic about measles.
How dare you cripple and maim and murder the minds of our children?
I used to think vaccines were safe, and now I know that they are not.
They may have faith, conviction, but to their critics they're known as the vaccination deniers, accused by leading health figures of risking lives and spreading misinformation online in an era of fake news. Today, the head of NHS England called those anti-vaxxer myths on social media dangerous, as new research by UNICEF found more than 500,000 children under the age of 2 in the UK missed out on the MMR vaccine between 2010 and 2017. And you don't need a degree in data science to see just how steeply cases of the virus rose in Europe last year. Sarah Walton was left severely disabled when the measles she had as a child returned. Her mum, Jo, says she wished she'd known just how dangerous the infection could be.
I'm just really disappointed that the message that seems to be being got out by the anti-vaccination proponents is taking more hold in parents' minds than the possible risks of not protecting their own child, let alone the knock-on effect on other people and other children who either are too young to be vaccinated.
Measles, mumps and rubella given together may be too much for the immune system of some children to handle.
In the UK, distrust in vaccines can be traced to more than 20 years ago, and the now discredited theories of Andrew Wakefield, whose Lancet paper became the talk of parents in the playgrounds. He claimed there was a link between the MMR vaccine and autism. A huge drop in vaccination rates followed.
And that's going to develop about 3 days after.
Health officials say that anti-vaxxer message is even more worrying in a fake news era.
So this woman claiming to be a doctor, clear message there, don't panic.
Well, the headline, a benign childhood illness, and the fact is it's not a benign childhood illness. I mean, children die from measles. What we know is that sometimes people who give these messages want to create that atmosphere of doubt, uncertainty, controversy. And we know that young parents, with your baby, you are very concerned about that child. You're very worried. You want to do the very best you can for your baby.
While the UK government are looking into new laws to stop the spread of so-called anti-vaxxer propaganda on the social networks, this month in New York, the mayor declared a public health emergency after a measles outbreak in the Orthodox Jewish communities of Brooklyn. And closer to home in Manchester, cases have spiked too. Today, leading charities said a combination of complacency, misinformation and scepticism around vaccinations had led to a measles ticking time bomb.
Well, joining me now is Josh Smith, a senior researcher at the think tank Demos, who studies technology and its impact on our society, economy and democracy. Josh Smith, how much do you think that social media fake news has contributed to the spread of measles?
Well, we've known for some time that people are being exposed to negative messaging around vaccination on social media. I think one study suggested that 2 in 5 parents had at some point seen this kind of content. There have been studies between the links between online talk about vaccination and your exposure to that and your decisions to then vaccinate your kids, which is tenuous at the moment, but they suggest that there is a connection between them.
So how do you combat that?
Well, so this content is exactly the kind of stuff that does really, really well online. I mean, take, for example, a really emotive picture of an ill child and a claim that vaccines have done that. It's emotive, it's visual, it's a human story.
And you can't necessarily tell that it is fake news. I mean, it's hard to tell whether it's truth or not.
Right, and it's really hard not to want to empathise with someone who's, claiming to have been through all this hardship. It's also exactly the kind of stuff that social media platforms are designed to surface and to show up in search bars and on the side of your, feed because it's popular.
So the algorithm sort of contributes to the spread of that?
Right, because the algorithm is designed to promote content which is more likely to be interacted with. And again, if something's emotive or if it's, we know negative messages spread faster than positive messages online. All of these things contribute to make a kind of perfect storm of human and technical drivers to make this content really virulent, if you'll excuse me.
So how, just to go back to my original question, how do you combat that? And are social media companies doing enough to tackle this themselves?
So I think we know that social media companies, and I'm hesitant to use Facebook as the example here because they've got a lot of resources and a big policy team, but they've thought quite hard about how to remove terrorist content and child sexual exploitation images. Often those get removed from the platform before it even hits it. So we know that something is possible here. Thing is, we're not in the same area. These are both places where we as a society have agreed that there's a clear form of danger here in extremist content, for example. It's not the same for vaccination. So I think there needs to be a process of saying, right, the evidence is mounted up, we need to take action on this, and we want to know what you tech companies are going to do about it, but also why you're having the response that you've had.
Well, Facebook does say on this that they're reducing the distribution of misinformation. But do you think the new online regulator that the government's proposing will help?
I think it will help if it's taking the right kind of evidence into account and if it is completely transparent at each stage what it is doing about things. This new regulator is going to have a lot to deal with, everything from extremism to advertising. So I think if it works with the charities like UNICEF who've been looking into it, then yes, there's potential there.
Josh Smith, thank you very much for joining us.